Hi, Susan. I'd like to go over your discharge instructions with you before you head home with you and your baby. Is that okay?
All right.
Great. First, I want to talk about is something we're going to have you go home with, and it's called your bulb syringe. Uh, it's really important that you keep this with you at all times. You will use this to suction out the baby's nose and mouth if they begin to choke.
Okay.
So, how to use this is first and foremost, you always suction out the baby's mouth first. And then you will do this by compressing the bulb and then inserting it towards the inside of the cheek. And then you will release the bulb and remove it from the baby's mouth.
Okay, that makes sense. So suction mouth first, insert inside of cheek, release, then remove. Easy enough.
Perfect. Next, I kind of want to talk to you about is bathing and umbilical cord care. And for the umbilical cord, until that cord falls off, which is usually between 7 and 14 days, you're only going to be giving your baby a sponge bath. You want to make sure that the cord stays dry. You can get it wet during the bath, but you need to make sure it dries out. And while you're giving the baby a bath, it's a perfect time to check for signs of infection on that umbilical cord stump. And if you see any signs of infection, you're going to need to report that immediately to your doctor. So the things you're going to be looking for are redness, swelling, like a discharge that looks really gross, kind of like it's called purulent discharge, kind of like pussy. It's not good, and it's going to smell really bad. Next is when the baby has the diaper on, you want to make sure you fold down the front of the diaper so the cord is dry and exposed. Do you understand things so far?
Yeah, if I see swelling, redness, bad smell, or gross discharge, I need to notify my doctor. Make sure I keep the stump dry. It's okay to get it wet in the shower, but make sure you dry it off afterwards.
A shower?
A sponge bath. My shower. Until it falls off, and I'll keep the front part of his diaper away from his stump.
Perfect. In terms of bathing, you want to make sure, since we're on that topic, you want the temperature of the bath to be 99 degrees Fahrenheit. You don't want to bathe the baby every day. It's going to be really bad for his skin. You want to do it every other day. It's fine. Make sure that when you're bathing him, and don't retract the foreskin as it's still attached to the head of the penis until around age 3. And you want to make sure you always get your baby completely dry and back in his clothes and a little cap on. And do not use any lotions, potions, or creams on your baby's skin. Understanding things so far?
Yep.
Perfect. So when it comes to baby sleeping, there's some requirements in the baby's crib. So he won't suffocate. You want to make sure that mattress is firm. You don't want to have any stuffed animals, pillows, or blankets in there. And you want to make sure that baby is laying on his back and the room is at a very comfortable temperature, warm temperature for the baby. And also, as a side note, since you're going to be breastfeeding him about 8 to 12 times in a 24-hour period, you want to make sure you wake him up for feedings if he's sleeping. And I'll actually cover more on the breastfeeding part next. You understand? Do you understand the instructions about the bed and everything?
Well, you said a firm mattress for the crib, no pillows, blankets, or stuffed animals. His grandma's gonna be mad. He won't be sleeping with the baby penguin she got him, but I'll explain its importance for his safety. And you said I need to make sure the baby is sleeping on his back, and when he's breastfeeding, make sure to wake him up.
Perfect. Great. It seems like you're really absorbing the information well so far. So I mentioned we'll talk about breastfeeding, so we'll start there. Just a little fun tidbit. The American Academy of Breastfeeding recommends breastfeeding exclusively for the first 6 months. The benefits of this are like enhanced cognitive development. It transfers your antibodies to the baby through the breast milk, and it also decreases his risk for diabetes and childhood obesity, which is really awesome. So during your prenatal classes, they should have discussed different ways you can hold your baby during breastfeeding. Do you remember those? Like cross hold, the cradle hold, across the lap, cross cradle, the football, football hold. Not, I'm just kidding. And do you remember those ones?
Yeah, I remember those. I like the cradle hold.
Perfect. That's a good one. So to encourage your baby to latch onto your breast, you want to activate his rooting reflex by rubbing your nipple along his cheek and lips. This will cause him to turn his head towards his nipple and open his mouth. You want to make sure that when he's latched to your nipple, that he has the full nipple inside his mouth and at least 1 inch of the areola in his mouth as well. If he's latched on correctly, his mouth, nose, and chin should all be touching your breast. You should be able to feel like a pulling sensation and be able to hear him gulping, just like you do when you're eating. You'll expect to feed him 8 to 12 times in a 24-hour period. Make sure that you're alternating at each feeding between the breasts, and that will help promote milk production. Everything's good so far?
Yep.
Great. So in terms of diapers, since he's going to be eating so much, you should expect dirty or wet diapers. During those first 6 days, he should have about 1 dirty diaper a day, or wet diaper. And then after the 6th day, it should increase up to 8 or more a day.
That's a lot.
Yeah, but it's a healthy sign. It's a sign that your baby's actually really healthy.
I'll make sure to get daddy involved.
So next we're going to kind of go over some things you need to know to report to your provider. First is you will take your baby's temperature under the armpit, and the temperature range you are looking for is 36.5 to 37.2. And anything above or below that, you're going to need to notify your doctor, okay? Other things you need to look out for and report to the baby is like if the baby's vomiting quite frequently, he's having diarrhea, he's not eating, his skin becomes blue, that could indicate some respiratory issues and he's not getting sufficient oxygen. That also ties into difficulty breathing. If you see he's having a hard time breathing, any eye drainage, bleeding from his umbilical cord stump, and or if he's just constantly crying and there's nothing you can do to kind of like calm him down and comfort him. There's also things you need to look out for yourself, which is just, your health is just as important. So things you're going to look for in terms of yourself, in terms of needing to report to the doctor is if your vagina starts bleeding more, you're noticing an increase. If your perineal pads the blood smells really bad, like the lochia is smelling bad. If you notice any pain and reddening, swelling in your calves, it could be indication of can't remember the word. Sorry, guys. It's an indication you need to let your provider know. Things you're gonna also look for is if you're not able to go pee or you're not going enough. That could be a sign of complications. And if you have a fever, that's also something you need to let the doctor know right away.
What about, is there going to be, am I going to have any pain in my breasts or nipples?
Oh, well, yes. If you have pain in your breasts that are any redness or warmth or cracked nipples, those could be sign of mastitis. What you can kind of do for the cracked nipple part, you could rub the milk on the nipples and it'll help soothe it a little. And you want to be making sure you're drinking lots of fluids because you are taking those pain medications, at least like 2 liters a day.
How much is that in ounces? Okay, I can do that.
He wasn't supposed to ask that. I'm not good at math. Next is printouts. So that about covers everything we wanted to do in terms of patient teaching today. Do you have any questions or concerns?
That's a lot of information. I don't know if I can remember everything.
Well, don't worry. I got you covered. I'll be giving you handouts with all the information and instructions that we just discussed today, and I'll make sure you have that with you when you leave.
Okay, that would be great. Thank you.
Is there anything else you would like?
I think I'll take a nap, if that's okay.
Sure. Resting's an important part of the healing process. I'll come back and check on you soon.
Okay, thank you.